Hi guys, so this video is going to be a little bit longer today because I wanted to discuss some common misconceptions about acupuncture, and there are so many misconceptions about acupuncture. I'm sure there's even more than what I'm going to discuss today, but I thought that by maybe discussing some of these misconceptions, we can clear up the misunderstandings and it will help to make acupuncture more accessible and also help to show people the amazing and powerful benefits that it has and all that it can be used to treat. Today I'm going to talk about 6 misconceptions about acupuncture that I hear a lot. The first misconception is that acupuncture is painful. This is one of the most widespread misconceptions, but acupuncture should never hurt. The needles are very thin, as thick as a human's hair or a cat's whisker, and the tip of an acupuncture needle is blunt and rounded. You can see here, it's also very flexible. Upon being inserted, you may feel a sensation, and it might be similar to an achiness or a heaviness in the area where the needle is, and this is totally normal, but a lot of people report not feeling anything except for calmness and relaxation. The next misconception is that acupuncture can only be used for pain management. While acupuncture is definitely known for helping to manage pain conditions, it is not limited to just pain relief. Because of acupuncture's holistic approach, there are so many different health issues and symptoms that acupuncture can be used for, including stress, anxiety, digestive disorders, and more. Check out my video on what acupuncture can be used for more information and more specific symptoms that acupuncture can help with. Just as an example though, the World Health Organization recognizes acupuncture for over 100 different diseases, illnesses, and symptoms. The next misconception is that acupuncture is only a placebo effect. First and foremost, this is my personal belief on this misconception, is who cares if it was a placebo effect? If you're no longer in pain or experiencing a symptom, then that's the most important thing, right? You're out of pain, you're not experiencing the symptoms of anxiety or migraines anymore. That's the point, regardless of if it's a placebo effect or not. Ultimately, you're feeling better. That's my personal thought on that misconception, but that aside, there are numerous studies that have shown that acupuncture has physiological effects. It has been scientifically shown to release endorphins, improve blood circulation, and modulating the nervous system. There was a study that came out as recently as 2022 that not only showed a significantly larger decrease in migraines in the real acupuncture group than the sham acupuncture group, but also showed through functional MRI that after acupuncture treatment, the migraine patients in the real acupuncture group showed significantly enhanced brain connectivity between the right amygdala and right middle cingulate cortex, the left middle temporal gyrus, and the right superior temporal gyrus. So as acupuncture is continuing to become more mainstream, there are more studies being done to prove that acupuncture is not just a placebo effect. As a final note on the misconception of the placebo effect, acupuncture is done on animals all the time by animal acupuncturists and veterinarians, and animals don't have a placebo effect. And people are still seeing results in their animals of having less pain, more mobility, less inflammation, and less symptoms overall. So that also busts the misconception as well. The fourth misconception is that acupuncture is only for Eastern medicine enthusiasts. This is not true. Many Western medical professionals recognize acupuncture and its benefits, especially in the chronic pain world. There are so many more physicians that are referring their patients to acupuncturists and seeing the true benefits of acupuncture. You also do not have to believe in acupuncture for it to work. Acupuncturists have many patients that used to be skeptics and experienced it for themselves and now are some of their long-standing regulars. Acupuncture treatments speak for themselves if you're willing to give it a try. Okay, so number 5, instant results. While there are some people that have immediate relief after their first acupuncture treatment, acupuncturists tend to tell their patients that after 5 treatments, you should start to notice some sort of shift. If the condition is a chronic condition, we tend to say that it'll take 1 month for every year that you've experienced the symptoms. So if you've had this pain for 5 years, it could take up to 5 months for the pain to fully shift and stop. A series of treatments is usually recommended upfront, with maintenance treatments spaced out once your symptoms are shifting. Acupuncture is very individualized to your symptoms, so this is a conversation to be having with your acupuncturist throughout your treatments. And the last misconception of acupuncture is that needles are inserted randomly. This is not true at all. Acupuncture is a highly skilled practice, and there are specific patterns and meridians when it comes to inserting needles, and the placement of the needles are based on traditional Chinese medicine principles and the patient's unique symptoms. Thanks for joining me today and learning a little bit more about acupuncture and for busting some of these common misconceptions.